I'm excited now to turn to our panelists to continue this discussion. I encourage you all to read their full bios because they're amazing, and we're so fortunate to have such thoughtful and experienced panel members with us today. I'd first like to welcome Dr. Bashara Shukair. Dr. Shukair is Senior Vice President and Chief Health Officer with Kaiser Permanente. Dr. Shukair oversees the organization's efforts focused on addressing social health of its 12.2 million members and 68 million people who live in the communities it serves. This work includes the creation of the nation's largest social health network integrated in Kaiser Permanente's healthcare services. And next, I'd like to welcome Dr. Susie Lopez Guerra, Director of Community Relations with Santa Ana Unified School District. Dr. Lopez Guerra collaborates with local businesses, community organizations, parent groups, and other departments and school sites to establish and sustain mutually beneficial partnerships. And I'd like to also welcome Sam Allen, Chief Operating Officer with Salesforce.org. Sam excels at aligning core business with strategic goals. He's experienced and adept at mergers and acquisitions, venture capital, and angel fundraising. Sam serves on the board of directors at Habitat for Humanity of Greater Sacramento, he serves on the board of directors of Greater San Francisco, and he is also a U.S. Marine Corps veteran. Welcome. I'm so pleased to have all three of you with us today.
Thanks for having me, Debbie.
Thank you, Debbie.
We certainly appreciate you being here. Thank you. So to start us off, we'd like to go ahead and jump in and maybe get a little bit personal. We have tremendous collective intelligence at this summit today, thanks to all of you. And each of you has a unique perspective based on your work, based on your sector, and your own personal experience. So to start off, we'd love to hear why stable housing in California is core to you and your values. And I think we'd like to start with Dr. Shukair, and then we'll hear from you, Sam Allen, followed by Dr. Susie Lopez Guerra.
All right. Thank you, Debbie. Thank you. It's great being with everybody here this morning. So I'm Bashara Shukair. I'm a family physician by training. I trained in a residency program that was embedded within a healthcare for the homeless program. And very early on in my career, I got to appreciate the connection between housing and health. And I remember one of my very first patients that I was talking to at one of the homeless shelters. He was about 50 years old, and I just finished medical school, and I was so committed to delivering the best healthcare possible. And at the age of 50, I was really convinced that I needed to talk to this patient about getting a colonoscopy for screening for colon cancer. And I talked to this gentleman for a while, and then he looked at me after a few minutes and he's like, dude, what is it you don't get? This is my first night being homeless. I'm worried how I'm going to be able to sleep here tonight. I don't know where I'm going to get my next meal. The potential of getting colon cancer 5 years down the line and what to do to prevent that is the least of my worries at this point. And that interaction with this person stays with me every day. And year after year, research study after research study, more evidence showing up every year shows the clear interconnectedness between housing and health. And I don't think we can expect anyone to be able to live healthy lives if they don't have a stable roof over their head. And that's really why, as an organization, Kaiser Permanente is committing lots of resources to be able to support and expand affordable housing in our communities and make sure that our members or people living in our communities have a good path to be able to have stable housing. So I'm looking forward to the conversation today with Susie, with Sam, and with you, Debbie, to talk about the interconnectedness between not just housing and health, but really housing and education and housing and corporate. So I'm looking forward to the discussion.
Great, thank you. That's an incredible story. I think we can, all imagine why you carry that with you. And sometimes, yeah, we're so focused on our mission that we can often just miss the boat on what is, right in front of us. So thank you for sharing that. Sam Allen, we would love to hear from you, your perspective.
Yeah, thanks again for having me this morning. This is great. For me, it comes down to two things. First and foremost, I am a veteran, and many veterans are not available to afford housing in California. They move to this amazing state when they're young. They fall in love with it. They get married. They have children. They sacrifice a lot, and you don't join the military to make money. They get out of the military and they want to stay in California, and many of them just can't afford a home. And that's just really unfortunate. And so that's the first thing for me. The second, I've spent 20 years here in the Bay Area in the technology space. And, when I first started, I couldn't afford to own a home. I rented an apartment. But I remember thinking back to all my friends who lived back in the Midwest where I'm from, and they all owned their own homes already. And what's more interesting more recently is with COVID, I have probably somewhere in the neighborhood of 50 to 60 people in my organization that are under the age of 30. And almost all of them have left the Bay Area on a temporary basis to move back home with parents, move back to where they're from, because they're just not in a space that's conducive to working from home, because they live with 4 or 5 roommates. And if you're all working all the time, having 4 or 5 roommates might be okay. But if suddenly you're all thrust together and you're all in the same space, it's just impossible. And so these are well-paid people that work in the technology space, and even they can't afford, to either have less roommates or even afford a home on their own. And so, it's an unfortunate situation we're in across the board, from homelessness all the way up to well-paid professionals that can't afford their own homes or even their own apartments today. And it's just got to change. And we can't just simply look at the macroeconomics and say, well, it's just the way it is. We've got to drive more change to get roofs over more people's heads.
Thank you, Sam. We all appreciate hearing that. I mean, that's such a direct perspective on why housing is so important to you. And I want to thank you for your service. As you know, Habitat does work with veterans as well. And one of our Habitat leaders, Andrew Colleen in Solano, Napa, they have done quite a few programs. And, to quote him, one of the things he says is, veteran and homelessness are two things that should never be said in the same sentence. There's just something clearly wrong there. And certainly what you're sharing in terms of housing and the workforce and still not being able to afford is so powerful. Thank you. Dr. Perez-Guerra, we would love to hear your perspective.
Yes, thank you, Debbie. For education, it's a very vast platform when we're talking about education and housing. COVID-19 has heightened the need for families to have stable resources, primarily stable housing. And we see now, as my colleagues were mentioning, the need for space for students to learn. Often in education, we're looking at this whole concept and focusing on balloons, right? What do students need to learn? But the focus now, given COVID and the reality of housing, has gone down to look at Maslow's. What are those basic needs? And housing is a basic need. Shelter is a basic need. In Orange County, when housing is so expensive and the median wage is so vast, we see these inequities that we're discussing, primarily heightened by COVID, but the reality for many of our students. And we have seen how housing, more so than ever, has been imperative in the way in which they succeed, in the way in which they're able to navigate the current situation. So right now, more than ever, education and housing are hand in hand. As an educational institution, one of the shifts that we've had to do was ensuring that students have basic needs and basic resources, primarily addressing the inequities or instabilities in housing, food, and basic resources.
Thank you, Susie. We all have had so much respect for educators, and there's been so much on the teachers' plates, schools, administrators, and now there's even more, and it's so valuable to hear what you're seeing and sharing. we'd like to talk a little bit about the cross-sector influence and participation. It really takes all of us to try to address this, and it's critical if California is truly going to address housing affordability. To quote you, Dr. Shakir, I believe you said, and Habitat absolutely agrees with you, that it's nearly impossible for a person to achieve and maintain good health if they don't have a stable roof over their head. What would you say is the most significant impact that the housing shortage has had on health and well-being?
Thank you, Debbie. Obviously, the connection between housing and health is so clear, and we've seen that year after year. We've learned about that from research studies. We've learned about that from the evidence, from publications, and it's just common sense. I mean, what we know, on average, a person who's homeless lives about 27 years less than someone who's housed. Think about that for a moment. 27 years less. And the reason is you're on the street compared to someone who has a stable roof over their head. We also know that a homeless person, once they're admitted to the hospital, chances are they're going to stay 2 to 3 days longer in the hospital. We also know that when you discharge someone from the hospital, if you're homeless, you have a 50% chance to be readmitted to the hospital. And we also know when you look at total cost of care, if you're homeless, your total cost of health care is about 3 to 4 times higher than when you're not homeless. So this connection is so clear, and we have, as a health system, we have to have other health systems step up and try to figure out what role can we play to really be able to make a difference. So a few years ago, Kaiser Permanente joined forces together with Dignity Health, now Common Spirit, and Trinity Health, based out of Michigan. And we've created the Healthcare Anchor Network, and that's a coalition of about 47 of the largest health systems in the country. And we said together, what role can we play as anchor institutions in our communities on all different elements that impacts health? And housing is one of these key strategies that we needed to focus on. And we've seen across the system, Debbie, across the country, healthcare system after the others stepping up and saying, we have to be paying attention to our patients' housing status. We have to be paying attention to the affordability of housing in our communities. And part of the efforts that we've launched back in 2018 at KP, we've dedicated $200 million of impact investment to support and expand affordable housing in our communities. And over the last year or so, year and a half or so, we were able, as part of these investments, to preserve or add about 3,100 affordable housing units in our communities. And we truly believe this is a key step that others could be able to follow suit, do the same type of work. And keep in mind, those $200 million were not given in grants. Those are what we call impact investments. So we've worked with our Treasury Department, and we said, out of the money that we invest in the market, can we take out a portion of these dollars, and instead of invest it in the market, let's invest it in projects that not only give us financial return on investment, but could give us social return on investment. And no better investment, honestly, is than the investment in affordable housing. So that type of effort, any corporation can do, any business can do, whether you're not for profit or for profit, that would still allow you to bring in some financial return, but most importantly, bring you social return. And in the affordable housing space, just add more affordable housing units in your community.
Thank you. And we're so appreciative. We love how Kaiser Permanente has really been a champion around this. You know, all of us housers, we can keep screaming at the top of our lungs, and as other sectors and industries start to recognize and work together and, you know, really be trailblazers and invest. And it's so powerful that you have the accountability and the impact in there. We know how important that is, and we can recognize the results. I'd like to invite Dr. Perez-Guerra and then also Sam Mallon to go ahead and comment, if you'd like, either related to your industry or on anything that you heard Dr. Shakir say. Let's start with Susie.
Yes, thank you. Thank you, Dr. Shakir. I really appreciate everything you're saying. And I have to say that as an educational institution, we welcome those partnerships, because part of the transitions that we've had to do is work with nonprofits and for-profit organizations to create that direct linkage between families who are in need and the resources that are available. So the more that corporate organizations have these opportunities to engage with educational institutions and make that direct connection, I think we'll continue to enforce that social improvement. One of the things that I want to say that as a district we're exploring, and particularly with Habitat, I know we've been in the initial conversations, is how to turn some of our, because of declining enrollment and because of the impact that the cost of living in California has had on our population, we're having conversations about turning schools into living houses for either foster youth, because the number is so large in our community, or for teachers starting out, or classified staff, which is our entry-level positions. And I think it's very important as we move forward to have conversations with organizations such as Kaiser to see how else we can connect to make sure that the resources are being connected to the people who need them the most.
Thank you.
Yeah, from my perspective, go ahead.
No, I was just going to invite you to comment, Sam.
Okay.
Go ahead.
All right. So thanks for that. The wonderful world of virtual meetings. For first and foremost, my wife's a second grade public school teacher. So I just, I got to give a shout out to our educators. What they're dealing with right now is amazing. So thank you for the work that you're doing. From a for-profit space and in the business world, it really comes down to, you really want a focused workforce. And if you have people in your workforce that are struggling with putting a roof over their head, and by the way, the doctor's comment about, I think it was 50% higher probability of entering back into the hospital system for homelessness is just sobering, to say the least. So, but if you have people in your workforce who are not focused on work because they can't get a roof over their head, or it may not be them, it might be their brother or sister, a niece, an uncle, or whatever, they're just not productive. And they're really focused on things other than their job. And we also know that for them themselves, anybody that's got a roof over their head is just in a much more stable place, right? Whether they own the home or rent the home, if they have a roof over their head, they're in a better position. And what we can't do in the business world is just look at that and say, "Oh, that's a problem," and then turn around and go back, in our business. We've got to really focus and provide capabilities and resources above and beyond just donating money, and that's an important piece of this, of course. We've got to find other ways to be part of the solution, because it's just too critical. Especially in California, it's very acute. But this is a nationwide and even a global problem, which is why Habitat's such a great partner, because they have that global footprint. But the business world needs to tuck in here and be part of the solution.
Thank you. We could not agree more, and that's why that's what we love our partnerships with the private sector. I'd like to turn a little bit more toward education. You briefly mentioned this a little bit, Dr. Perez-Guerra. You know better than we do how stable housing really has an impact on children, or the lack of has an impact on children. Certainly, if families are chasing affordable rent, then there's a lot of disruption, and it's difficult to achieve academically. Could you comment a little bit more on the recent trends and the challenges and how that is impacting what you see in your students and families?
Of course. Thank you, Debbie. One of the things that Orange County has encountered is this wide economic range, right? For Santa Ana, it's not as monolithic as many people like to think. However, we have experienced throughout the last 5 years great mobility outside of Orange County. And as I mentioned earlier when I was talking about a Maslowian approach, in order for our students and our families to reach that level of self-efficacy in a way in which they can really thrive, they need to make sure that those basic securities are met. COVID right now has brought that to the forefront more than ever. As Sam was saying, teachers are teaching either at home, and And that's one of the things that we had not considered. We'd made assumptions and accommodations for our students and our families, but we did not go out and think of our teachers. The expectation or the assumption was that they all had their own home, their own space to teach. And now we're noticing, and we've seen different posts throughout of different people conducting meetings, right? You have teachers who are living with multi-generational families who now have to identify a space that's going to be quiet for 5 to 6 hours in which they can focus and conduct instruction. Some of them don't have space. The same thing with students, you know, if you have 5, 6 students, as a doctor was mentioning earlier, and they're all engaging in different classroom activities, it's merely impossible, let alone in a 1-bedroom apartment that's housing 15 people. So now more than ever, we know that a proper shelter supports educational advancement. But not only that, if children and families don't have to be worried about moving around, they can develop stable relationships that then allow them to really engage in adequate learning, building those relationships that have lifelong impact, not only on their academic development, but also on their social and emotional development, which go hand in hand.
Yeah, you know, Debbie, if I can add, I mean, Susie's comments are so right on, and you know, we know how housing is so critical before the pandemic hits, and now that we're in the midst of a really serious, dangerous pandemic, we're realizing how housing is even more critical. Just 2 quick example to give you that kind of appreciates that importance there. One, you know, we talk about, oh, keep 6 feet apart from each other, do social distancing, wear masks, you know, do all of these things that makes total sense for all of us who are living comfortably in our homes. Think about how would you be able to apply these types of recommendations in a homeless shelter. You know, how can you actually get to a point where you can implement these practices in a homeless shelters that are already overcrowded? So you have additional layer of complexity, and that's not even talking about the complexity for our workers, you know, for our homeless workers who are in these shelters, in soup kitchens, trying to navigate the complexity of staying safe and yet still be able to serve this population. The other example I'd want to give up is I want to share with this group is when you're thinking about diagnosing somebody who ended up being testing positive and they have to isolate and their contacts would have to quarantine. And when you have people doubled up and living with other family members or with friends, and just like Susie mentioned, when you have, and we've seen example after example of 5, 7, 10 people living in 1 or 2 bedroom apartments, it's almost impossible to be able to isolate or quarantine in those types of settings in a safe way that would prevent the transmission of the virus to other people in your household. So I think what we're seeing with the pandemic is it's putting the impact of lack of housing, the impact of homelessness on health even more into perspective.
Yeah, absolutely, absolutely, and that's why it's imperative that we're having these conversations and focusing on more solutions. We want to talk a little bit more about the workforce. According to Harvard's Joint Center for Housing Studies, 41.6, almost 42% of California households are housing burden, meaning that they're paying over 30% of their income toward housing. This is whether it's rental or ownership. And this is true at every income level, not just low income. So what this tells us, this demonstrates that we're not just talking about wages, but it's about supply. It's about lack of availability. There's just not enough entry-level housing for young professionals or families who are even earning 100 or 120% of the area median income. Sam, you alluded to this in terms of your workforce, making pretty good wages and not being able to afford. Can you speak a little bit to your sector and maybe Salesforce specifically about how you're coping with that, with retention, and maybe some advice that you have for other business leaders on how we can tackle this?
Yeah, so I did touch this a little bit. We're in the heart of Silicon Valley, and there's been a war we call a war for talent here for decades. And at the end of the day, we compete against all the other technology companies that are surrounding us. And we're an amazing company. I'm not just saying that because I carry the badge, but it is truly an amazing company. And we have to fight hard for the employees that we have, because this is a knowledge-based business. This is not about labor or anything like that. And so it's about brain power. And in a world where housing is so hard to get and expensive, even for those making great wages, it makes the war for talent even more difficult because you have to basically overpay an employee to get them to come to your company. And those are resources that can be better spent in research and development. They can be better spent in improving the community in which you live. There's lots of other things you can do with that money. And then COVID has highlighted or amplified this challenge and this problem. And as I said, we now have a pretty decent size of the workforce, generally people under the age of 30, 32, 35, who are leaving the Bay Area. And these are people that actually do make great money. And that's a drain that we don't want as an ecosystem. We don't want those people leaving. We want them to be invested in their community. We want them to stay. Those are future leaders. Those are people that are going to continue to provide help and go swing a hammer at a habitat site. And seeing them leave is hard. And they go back to Indianapolis or St. Louis or Atlanta, and they're buying 3-bedroom, 2.5 homes, and they were living with 3 other people in an apartment in Nob Hill in San Francisco. And that's just got to change, because I do believe that it does trickle all down. And if we're going to start losing people in the middle income, that's just going to exacerbate the problem over time. So what are we doing about it? We, first and foremost, we are trying to provide as many, services as we can to our employees. We're giving them the freedom of movement that they need to, take care of loved ones or take care of themselves. We're really trying to constantly tell them and have a drumbeat of communication that says, take the time that you need. If you have an elderly neighbor, like I do, I have a woman who's next door to me who's 82, and that's really scary in the time of COVID. And so we're trying to help her out, right? Because she doesn't have family here. I need time to do that. And so we have to give our employees the time to do that. The best advice I can give other people out there, whether you're in for-profit space or not, is to really just have as much empathy as you can right now. And then provide as much as you can the technology capability. I think it's worth it to a company to take a financial hit to make sure that their employees have the assets they need. You've heard on this panel several times how challenging it is for students to be in a learning environment. It's the same with parents, especially if you have 2 parents that work and they're both trying to work and do Zoom calls and all that. So if you want a more productive, more healthy workforce, then invest in them in this time and give them the help them find resources they need to take care of kids or elderly parents or whatever. It's just really worth it to a company to invest in its workforce right now.
Yeah, thank you. That's helpful, and I know it's certainly a challenge depending on the size of the business. But empathy and in investing in our employees makes so much sense. I want to flip a little bit to part of the conversation that we've been hearing. You've all highlighted in your comments some of the racial inequities and social justice and lack of economic justice that we have. Recognizing that there is not one solution or one size fits all, do you have an idea, something maybe really bold that almost seems impossible, or maybe something that might be practical but California has failed to implement that you think would really be a good solution in this arena? Sam, I know you serve on the board of directors with San Francisco Habitat, and so I was going to invite you to comment on this first, and then we'll go to Dr. Shukair and then Dr. Perez-Guerra.
Sure. As a technologist, for me, technology. From online applications to measuring how we do impact, and of course, fundraising are all ways that Habitat is using Salesforce today and all the important work. And that obviously supports some of the racial inequality that we're seeing, or addresses, the racial inequality. Secondly, at Salesforce, we have this mantra of business as a platform for change. And that certainly rings true in this case. Businesses can provide grants With Habitat, they can provide pro bono services. They can send teams to help with construction projects. That's actually how I first got introduced to Habitat 20 years ago. I went and swung a hammer on a site here in Palo Alto, East Palo Alto, and it was an amazing experience. And to see those future homeowners next to you providing the sweat equity is just very empowering. So businesses can also empower their ecosystem of partners and customers to do all these things as well. I think businesses also understand, as I mentioned before, that better housing means a more productive workforce. So in some ways, it's self-serving. Another comment here, there's, as many of you probably know, there's a strong push with what's called a double bottom line, or some calling it triple bottom line. And that means it's just more about your profitability as an enterprise. Like, what are you doing to improve the world around you? And over this past summer, our CEO, Mark Benioff, has been pushing his message of stakeholder capitalism, because frankly, we're just honestly tired of waiting for government to solve the problem. And they're burdened with a lot of other problems besides this. And we've got to, like I said earlier, tuck in and be part of the solution. And at the center of the corporate social responsibility movement lies how our company not only cares for its workforce through things like employee engagement, which I spoke about, volunteerism, and socially responsible practices like going to carbon neutral, but also how they care for the communities in which they live and work. It's important to me as a resident in Redwood City, California, that the people around me also have opportunity in housing and a roof over their head. It just makes my community better. So things like matching funds, volunteerism, and engaging in nonprofits and schools are all really, really critical. I'm beating the drum here, but Salesforce, for instance, donates over $1 billion of donated product globally every single year. And we've issued over $300 million in grants, a lot of that to educational institutions. And Habitat projects remain one of the top volunteer activities for our employee base. Our employees love to go out and get their hands dirty at Habitat sites. So tracing this back to technology, we learn together, we pave a path forward with R&D, and we try things that can be adapted and scaled for use with organizations like Habitat. I think it's critical that the technology sector partner really tightly with the nonprofit space. At Salesforce, we've done this successfully. We've adapted our technologies and to fit the needs of not only nonprofits, but also educational institutions across the world, but specifically here in the US. So at the end of this, I think technology is a key piece of this puzzle. I think there are lots of bold actions out there that people are talking about. To be very blunt and honest with you, though, I think just coming back to some simple blocking and tackling, businesses have to get more involved. Yes, they have to donate money, but they need to provide services, in terms like pro bono help as much as they can.
Thank you. Yeah, we'd love to hear from you.
Debbie, so thank you, Sam.
Go ahead, Dr. Shukar.
Okay, great. I wanted to echo what Sam has mentioned. I can't agree more. And I think for me, maybe if I go like a few thousand feet also higher there, I think when we go upstream to address the root causes of poor health, we invariably encounter problems fueled by systemic racism and inequality. The reality is income inequality, racism and other forms of discrimination, societal neglect and disinvestment, these really are the underlying factors that create these conditions that lead to poor health, including this inequality and inequity that we're seeing in housing. So for me, a key bold way for everybody to step up and think more boldly about these issues is to take on head on to address systemic racism and inequality in our communities. And companies, we're seeing companies after companies, we're seeing organizations, people step up across the country and saying these things are just not okay. And we need to address these issues. We need to talk about them. We need to come to the space with a lot of humility, a lot of curiosity, to be able to partner with the right people to address these issues just right on, and not just kind of tackle with things that are around these issues and not name them. I also think it's really important to lift up our voices, be close to what's happening on the policy side in your community, whether you're at a local level, at a state level, or a federal level. There are lots of things that we can leverage our voices. Get to know your elected officials, and most importantly, particularly in this season, I really encourage us all to make sure that we're voting, because at the end of the day, it's that voice that matters, and it's really important that we all do that.
I could not have said that better. Yes, please vote. But I'm going to go back and thank you both gentlemen, because I love the word ecosystem, and I think that is at the root of addressing any social injustice, inequities. If we understand that we are part of this greater ecosystem, and that our organizations, be it health, corporate, nonprofit, for-profit, are not silos or standalones, that we depend on one another. And by raising others, and we raise the entirety of our community, our collective community, I think that's how we continue growing. So engaging in these collective partnerships with everyone in your community, your governmental agencies, your elected officials, your educational institutions, your workforce, so that we all have the same understanding of what the needs, what the resources, what the gifts and talents are, so that we can continue moving the voice forward. Inequities are brought forth because we disassociate ourselves with the needs of other people. Once we truly understand the human aspect, be it a homeless issue, be it a socioeconomic disadvantage, be it a racial issues, once we humanize each other, I think we're able to engage in these true ecosystem approach. And I love that, Sam, of moving forward. And I think that's exactly what Habitat does. You go into it, you engage everyone, and you let us understand and experience what it means to give of our talents, whatever they may be.
Thank you. You've given us so much to think about, and I want to sincerely thank each one of you, Dr. Shakir, Sam Allen, Dr. Perez Guerra. You've been so generous with your time and your expertise with all of us today, and we're so grateful.